Good afternoon. My name is Dr. Brett Whitfield. I am a joint replacement specialist and sports medicine specialist here at Ortho Virginia. It is my pleasure to welcome you to the Facebook Live forum from our Blacksburg office. For those of you who are not familiar with Ortho Virginia, we are the largest multi-specialty orthopedic group in Virginia. We have offices in multiple locations, including Blacksburg, Christiansburg, Lynchburg, Wytheville, Northern Virginia, Richmond, and Virginia Beach. If you'd like more information, you can go to our website at www.orthovirginia.com. But let's get to why you're here today, which is to learn about living with arthritis. There are over 100 types of arthritis, and 70 million Americans suffer from arthritic pain. That equates to about 1 in 3 people. So if you're sitting next to 2 other people, one of you has arthritis. Although there are a lot of different types of arthritis, we're going to concentrate on osteoarthritis today. It's the most common. It affects about 20 million Americans, and it is a wear and tear arthritis. So I always tell my patients, it's like wearing the tread off your tires. I like to break up the treatment options into 3 different realms. And there are the physical modifications, there are medications, and then there are also injection treatments. To get started in the physical modification section, one of the most important ways that you can help to live with arthritis is with physical therapy. And this doesn't have to be formal physical therapy. This can be therapy exercises that you do at home. As you develop arthritis, your joints are going to get stiff. When they get stiff, you're going to be inclined not to move them. That's the worst thing that you can do. You want to keep moving your joints, and that's going to keep you active.
Dr. Whitfield, I'm going to interrupt just a minute and move the microphone just so people are having some difficulty hearing. So let's just move it right up here, and hopefully that will help everybody out. My apologies for interrupting.
Okay. Can you hear me better now?
Yes.
I'll try to speak up as well.
Thank you.
I was talking about improving flexibility in the joints. As you develop arthritis, the joints get stiffer, especially in the winter, and this is when you're going to need to really work on moving the joints. With the exercising, you want to do low resistance, so low weight. This is not about doing heavy weight exercises, it's about low weight and high repetition. So again, a repetitive theory here is keeping the joints moving. One of the most important therapy exercises that you can do, especially during the summer, is pool therapy. So I call this aqua therapy or aqua aerobics. Most places have a community center or a YMCA that you can go in, and even if you're not a big swimmer, you can still get in the water. You weigh less in water, so that helps the joints move, and you can do laps you have to talk about, and that is maintaining a healthy weight. During this COVID pandemic, I call it the COVID 20 or 30 pounds. People have put on, just scared to go outside, nothing left to do but eat and watch TV. I'm a big Netflix fan, but unfortunately that's not going to help with arthritis. So the biggest thing that you can do to help an arthritic joint is to reduce the load on that joint. And with regards to the knee, for every pound you lose, you're going to lose 4 pounds of pressure on that knee joint. So think about it this way, you're getting a bonus. So you lose 1 pound, you lose 4 pounds of pressure. With the hip joint, you don't get that multiplier, but you still get to lose the pressure on the hip joints or on any other joint. Weight loss is not an easy thing to do. There are a lot of dietary things that you can do, and we'll get to one of those under the tips. The third point under physical modification would be bracing. And so a lot of times when patients develop arthritic joints, whether it be an ankle or a wrist or a knee, you can develop instability. And that instability comes with experiencing pain. So you have pain, the knee wants to give out, and then people will fall. And so we want to try to market. You can use a pull-up brace. That's something that you would likely have to get from either your orthopedist or a prosthetic store. The other thing that a brace does is that your brain can only factor in certain senses at a time. And it really doesn't like to factor in pain if it doesn't have to. So with a brace, it can provide pressure to the knee and to the skin around the knee. And a lot of times that pressure sensation overtakes the pain sensation. So it's like if a tree falls in the forest and no one's there to hear it. So you can still have pain, but the brain doesn't experience it. The last thing that a brace can do is, especially in the winter time, is it can provide warmth. Anyone who has arthritis in the winter, it's worse in the winter. And so if you have a brace on, you provide warmth to that joint, and that can help with dealing with arthritis during the winter. Now, if you're in Florida, you don't have to worry about that. The next part of the treatment is medications. There are a plethora of medications out there that people can take for arthritis. I'm going to start with the most common, which are the NSAIDs, or non-steroidal anti-inflammatories. This can be as simple as ibuprofen or Aleve. Now, obviously, if you have medical problems, you need to talk with your doctor before you determine whether or not you can take these. There are fancier prescriptions. We won't get into all of them because there's probably over 100 different, and your body never has the buildup of the anti-inflammatory action, and so it doesn't help as much. It's more of just a pain modulator rather than an anti-inflammatory. So I always encourage my patients to take the anti-inflammatory like you would take an antibiotic, where you take it for a short course, like 1 or 2 weeks together, and you take it consistently. This way you build up a level of the anti-inflammatory in your system, and it has a greater chance of putting out that fire wherever it may be. The second treatment option is one that is Tylenol. And if you're on a blood thinner or you can't take anti-inflammatories for one reason or another, Tylenol can help with pain, but it only helps when it's in your system, so it doesn't have the advantage of an anti-inflammatory. If you have issues where you can't take anti-inflammatories, there are some topical creams and ointments that you can use that do have medicines in them. One of them that's over the counter is Voltaren cream. Doesn't provide as much medicine to the area, but it can be helpful. There are also prescription compounding creams that can be written by your physician. These do help in areas where obviously in places like the hip where the joint is very deep, it's not going to penetrate that far. But it is something that doesn't affect the kidneys to that degree, and it's a little bit safer if you have a history of gastric ulcers or other problems like that. Can be a safe alternative to anti-inflammatories. People always ask me in the office, are there any herbal remedies? Is there any holistic medicines? I don't like to take prescriptions. I'm very weary of taking advanced medications. Well, there are some that have been touted. 2 that I recommend that you can try is curcumin and turmeric, and they are spices actually that have anti-inflammatory properties. And there's not any scientific data on them, but they are safe to try if you don't want to try other medications. One thing that I would like to stress in terms of medications is that in my mind there is really no role for narcotic medications to treat arthritis. And I'm going to say that again. There is no role for treatment of arthritis that includes narcotic medications. The only thing that's going to happen is you're going to cover up the pain, and then ultimately, if you do need surgery, it's going to make pain situations where patients are not surgical candidates for treatment of arthritis pain. We'll go down the road to the next more aggressive type of treatment that is still non-operative, and that is when we get into the realm of injections. Injections are a little bit more aggressive. They do involve a needle, but what you're able to do is administer the medicine right to the area of arthritis. So when you take a pill, it gets absorbed through the stomach. Some of it is broken down, some of it gets to one joint, some of it gets to another, but it's more of an indirect route to the area. Injections allow application of the medicine straight to the joint that is affected. We use this often in the knees, and we use it in the wrists and shoulders, every joint that you can use. It's not as common in the hands. It's harder to inject all the different joints, but it can be for isolated arthritic change. The first type of injection is a corticosteroid injection, and this is very similar to if you dissolved a Motrin and injected it right into your joint. There's different formulations. They include Celestone, Kenalog, but basically they are a type of steroid that's safe to inject into the joint. Second type of injection is what we call a viscosupplementation shot. People often recognize this as these lubricant shots. They do have some inflammatory properties, but it's easier to remember it as that. There's multiple different formulations. Some are a one-shot formulation, some are 2, 3, and I've seen even up to 5 injections that are done at 1-week intervals. And these can be very helpful. Now we'll get to some of a little bit more progressive treatments. There's not a lot of information on these, but they are available. One is called a PRP injection, and that is a platelet-rich plasma. We take blood, we spin it down, we take the anti-inflammatory components of that blood, and then we inject it into a joint. This is fairly new, although it's been used all over the body for at least the last 10 years, but they're still looking at data and efficacy on those. But they are definitely safe, and they are a lot of studies that show that they can be beneficial in reducing pain by reducing inflammation. The newest type of injection, where there's a lot of interest in going forward, is stem cell injections. These are injections where you take from either the bone marrow, adipose tissue, or umbilical blood, what are called myelodevelop into a different subset of cells. Again, the philosophy, or what's theorized, is that these cells, if injected into a joint, can help to reduce inflammation in that joint. Now, this is very new. They have been doing this for probably the last 5 years. But there hasn't been a lot of regulation in this field, and that's where the problem comes in. The FDA just released a statement saying that you need to be careful because there are a lot of places that are doing these with people that are not qualified to do the injection. So you need to make sure that if you're going to go down this route, do your homework, look it up. The problem with the internet, though, is there's not always people checking to see what's written on the internet, but that's where I would trust your physician. Ask your physician, ask your orthopedist. The data is still coming out, so there's not great studies looking at the degree of help that these shots provide. Just like the PRP injections, stem cell injections are not covered by insurance, so you do have to pay out of pocket for this, and that can be the setback, is that the stem cells are significantly expensive, those injections. But again, I look forward to seeing how some of this is going to be just repetition for what we talked about. But my first tip is keep moving. Keep those joints moving. And in order to do that, do your exercises. We're kind of like sharks. We like to keep moving. If we don't keep moving, we stiffen up. The second is watch your diet. There's such a big impact that weight has on our joints in terms of deterioration of the joint, as well as causing pain when you already have arthritis. One of the tips that I always tell my patients when you go to the grocery store, stay along the periphery of the store. That's where your vegetables are, that's where your milk is, that's where your meats are. Everything in the center is very heavy in calories. So unless you have to go there for specific items, do not peruse in the middle of the aisles. You want to stay around the side. Stay away from your pastas, stay away from your breads. All of those are very carb-laden foods. And so if you're trying to lose weight, stay around the outside of the store and get in and get out. Do not go shopping hungry. That's probably, most people know that already. The third tip is start treatments early. Don't wait until you can't move to go see your orthopedist. there's so many things that we can do to try to stop, or if you're going to go and do some walking, which is fine, go to a track where they have a cushioned surface. Walk on as long as it's safe, on a golf course. Don't walk on asphalt if you can help it. Make sure you have good shoes. Make sure you're not walking in hard shoes or sandals. Those are not going to be very helpful for reducing joint reactive forces. So all these things are meant to try to help you to live with the arthritis. Obviously, some patients are going to get to the point that they need surgery, but these are all tips to try to keep your own knee as long as you can. Now, in conclusion, I hope you found this helpful, and that I'd like to get to questions if there are any questions.
There are a lot of questions. So first off, thank you for that. That was very helpful. Let's see. The first question, and I hope I pronounced this right, is what about Xeljanz? It looks like Xeljanz. Is that a medicine?
Xeljanz. It sounds like a medicine.
I didn't know that was a popular one.
No, I don't generally prescribe that. I'm not sure. That may be one of the viscose supplementation shots. There's probably about 30 or so of those. So
thank you for that. What about CBD products? Any thoughts there?
Well, again, there's a lot of supplements on the market, and the problem is supplements only have to be proven safe. They don't have to be proven having efficacy. The CBD, I don't have any experience other than the fact that I have had patients that have found that it has helped. I think it's safe, and I think that if you want to go that route, there's no harm in doing that. They have different ointments and creams and salves. I don't think that there's a problem with that, and if it helps you and allows you to become more active, I'm perfectly comfortable saying that that's okay.
Okay, thank you. We had a question about what do you feel about arthritis in the feet? Is there anything to be done that will help that?
Well, I touched on the compounding creams. This is the one area where I think that the rub-on creams help. And I often prescribe a compounding cream that has a lidocaine as well as an anti-inflammatory. If it's neurogenic pain, like if you're diabetic and you have some nerve pain, they can also add medicines for that. But I think that the foot is difficult because it's made of, the structure is a lot of different joints. And, especially with increased weight, you can develop foot arthritis. Usually it's the midfoot, and that your footwear is not too tight, because I see a lot of patients that come in and they have sandals and they're just way too tight, and that's causing pressure there.
This question just came in, and since you're talking about arthritis in the feet, what kind of injections, if any, are available for arthritic fingers and toes?
Well, we use the same things. It's just, as I was saying before, the joints are so small, and it's not really feasible to inject every single joint of every finger of a hand. So usually with the hand and the feet, I'll either do the compounding cream where you can rub it on all the different areas, and there's usually not a lot of soft tissue over the joints. The other thing that I like for the hand, and actually can be used for the foot as well, is you can purchase paraffin hot wax baths. And they use this in physical therapy all the time. You plug it in, you put wax in it, it heats up the wax to a comfortable temperature, and especially in the winter, but also during the summer, you can put your hands in there and it heats up the joints, and it really helps with mobility. So that's another, it doesn't fix the arthritis, but it helps you again to live with it.
Perfect, thank you. I have one and again on the fingers. My fingers, especially my certain knuckles, are really
at the PIP joint or the DIP joint or the PIP joint. You can use the anti-inflammatories if you're a candidate for those, as well as the compounding creams or the Voltaren cream, the local application creams. But hand arthritis is very difficult to treat because we all get it, and it's just a matter of, and the harder you work, or if your genetics, if your mother and father had it, you're sort of predisposed to getting it. But a lot of people work hard, and that's the part that they wear out.
Okay, thank you. Well, one person asked, what if you're allergic to aspirin and can't take a leave? Any suggestions?
Well, the aspirin, and then that's always pops up on the pharmacy. So you're allergic to aspirin, and then they put a question mark, are you allergic to all the other different areas? And that's a cross reactivity that is very common. And it always, as a physician, we worry about prescribing those. That's something I would get with your pharmacist, because sometimes it's not a true allergy in terms of it's a true allergy to aspirin, but not the cross reactivity. And the pharmacist, I think, can help to help you to know whether or not there are any ones that don't have that cross reactivity. And I think maybe it works similar to what I was saying about the brace. So we have different nerve tracts that go to our brain. We have a nerve tract for hot and cold, for vibration, for touch, and for pain. And those 4 tracks are like train tracks that lead to the station. And there's only one track that leads into the station, and all of these tracks converge. So when you have a TENS unit on, the TENS unit activates the vibrational track, and what it does is it doesn't allow any trains on the pain track to get to the station. So just like ice, just like what I was saying about pressure, all of the other tracks have the right of way. So pain is the last track. So if you don't have any other input, then you get pain. But if you can find other inputs like a TENS unit or ice or pressure, all of those have the right of way. And you probably know my mother, when I would hit my elbow as a kid, she would say, rub it, right? Well, that's the treatment. It stimulates touch rather than letting the pain come through. So you weren't actually healing the area, you were just blocking the impulse to get to your brain.
That was a great analogy about the train tracks. That will help me personally. Okay, a couple questions have come through about glucosamine chondroitin and what your thoughts are on that supplement.
So I've taken that before. I've had patients to swear by it. It comes with or without MSN. You can buy a month's worth, take it, and if it helps, then I would continue taking it. It's proven, the FDA has said it's safe. The only question is whether it's going to work for you, but there's no harm. And I think the philosophy is that it's, that medicine has a constituent that is in cartilage. And the question is whether if you take that, it'll help to rebuild cartilage. Now, I don't think I can say for a fact that it doesn't help to rebuild cartilage. I think that it may have some role in helping to maintain that cartilage that you still have that's viable.
Perfect. A couple people asked about cryotherapy and ice baths, if the intense cold helps with the joints.
I don't think it helps with the joints. I think that's more in use. We do that in our sports medicine practice with athletes after training. Though, what it does is it blocks, it constricts the blood vessels, and it decreases the generation of lactic acid. So patients recover, or like athletes recover faster. So I think, like, if you go out and run 6 miles and you want to jump in a ice bath, I think that'll help with the muscles and help to decrease the what we call metabolic byproducts that are produced by muscles, ice, and you're not getting pain. So it's more, I think, of a symptomatic treatment. It can help, though, with swelling. So if you have a swollen joint, then the ice is very helpful.
Okay, thank you. A couple people have asked about meloxicam, and they thought you might have touched on it but didn't hear it earlier.
Well, I was trying to stay away from individual medicines per se, but that's Mobic. Meloxicam is the generic name for it, and it is a COX-2 inhibitor, so it's a little bit specialized. But the funny thing about that medicine is it's really only a COX-2 inhibitor at the lower dose, which is 7.5. At the higher dose, it functions more like the regular anti-inflammatories like ibuprofen or Aleve. Basically, when it comes to anti-inflammatories, the reason we don't just have one is that not one doesn't always work for the same person. So if one's not working, then I offer the suggestion of trying a different one. Now, if you go through 5 or 6 different anti-inflammatories and nothing's working, then you're probably past the point where the medicine is going to help and you need to move on to the next more aggressive treatment like injections. But I think it's a great medication.
Perfect. One one question is, what about hip arthritis after a hip replacement?
We actually can't have arthritis after a hip replacement if you had you don't have any more tread, you don't have any more cartilage, so you therefore can't have arthritis. Now you can have pain after a hip replacement from soft tissue impingement or loosening or any of the multitude of things that can affect the hip after, but you can't have hip arthritis once you've had the surfaces replaced on the hip. The one corollary to that, which is probably out of the realm here, is if you had a partial hip replacement, you can develop arthritis on the other side where the cup side is if it was not replaced.
Okay, thank you. I've had a couple of people ask about walking with osteoarthritis in the hip. Is the pounding going to aggravate that?
Well, the answer is yes, but I think there's ways that you can get around. We touched on a couple of those, making sure you have well-cushioned shoes. The other thing is to look at trying to walk on a more giving surface. I gave the example of a golf course if you live near that. Obviously, you want to make sure you're not going to get hit by golf balls, so it needs to be vacant. Also, tracks are often a more spongy material. Or just walking in the grass. That type of material is going to give more than walking on concrete. Now, the other thing that they have now, if you have access to a gym, is like elliptical trainers, because you don't actually have the pounding. So you get to initiate but you don't have the impact because your foot never...
The heels for plantar fasciitis.
Yeah, well, they've used the PRP injections all over the body. Because basically it is a anti-inflammatory type of injection. So they've used it in plantar fasciitis, they've used it for tennis elbow, they've used it for Achilles tendonitis. The studies are ongoing in terms of looking at the efficacy, but it has shown promise in multiple areas. So the answer is it can be, yes.
Okay, let me see if I say this correctly. Is hydrolyzed collagen helpful for arthritic joints?
Well, that's a newer topic right now, and again, as a supplement, there's not a lot of data on that, and so I'm going to have to plead ignorance in that without data, and that's how I determine what treatments that I do. There's a lot of things that are out in supplement stores with no information, no efficacy noted in studies. And so now if it's on the market, it means that the FDA has said that it's safe. So, if you have the financial means to try it and you want to try it to see if it helps, then I think it's safe, or at least the FDA wouldn't allow it to be on the stores or in the stores. But in terms of whether the shoulder's like every other joint, and the wonderful thing about arthritis is, unlike a fracture or unlike cancer, if you can live with it, then you can live with it. That's the biggest question with arthritis is, can you live with it? In terms of shoulder arthritis, the facets apply that we talked about in terms of keeping the muscles strong around the shoulder. So I recommend, even though it may be a little sore, doing repetitive type of exercises, low resistance, doing rotator cuff exercises to support the shoulder. But you can develop bone spurs, they can click, they can hurt. You can get injections of corticosteroids in there. There is off-label use of the hyaluronic acid injections, the viscosupplementation shots. I have had patients sign off-label use of those to be done in the shoulder. It just so happens that the FDA, when they approved the gel shots, they only approved them for the knee. Now, arthritis is the same, whether it's in the ankle or a hip, and so you can use that off-label. It just depends on the comfort of your physician in doing that off-label, and often you have to sign off on it, saying that you understand that it has not.
Perfect. Thank you. And that looks like that was our last question. If for some reason we did not get to your question or we missed it, we will circle back and follow them up with a blog just to let everybody know.
Perfect. Well, I want to thank everybody for tuning in. Hopefully this is helpful, and hopefully you'll tune in to our other Facebook Live events. And thank you for your wonderful questions.